emotions, mind, body, and spirit. This podcast is dedicated to individuals who are on a quest to uncover their truth, understanding their genetic and spiritual DNA, and learning how to harness this knowledge to achieve optimal health. But this isn't just another health podcast. Naturopathic Podcast is here to ignite a hope within you, reminding you of your innate potential for greatness, your pure love, and capable of living life to its fullest potential. Are you ready to embark on a transformative journey for optimal health? In today's episode, we have Dr. Carolyn Stone, who is a dedicated naturopathic doctor specializing in the treatment of Hashimoto's and hypothyroidism in women in particular, with a focus on holistic and integrative approaches. She delivers into both conventional and alternative therapies to providing specialized care. Dr. Stone's ultimate goal is to empower women with the knowledge and tools needed to manage their thyroid health effectively, ensuring a balanced and vibrant life. Welcome back.
Yes, thank you so much for having me. It's fun to come back like full circle, right? Let's see what life has to offer us now in the thyroid world, you know?
100%. I mean, look, last time we spoke was episode 233 in July 2021.
Stop. I didn't realize it had been quite that long. I was thinking 2022, but 2021. Dang, it's been a while.
Yeah, I know.
Definitely have more gray hair.
Yeah. That is so fun. It's like, oh, I've gotten a bit older. There's a wrinkle or two.
Yeah.
No.
For sure.
And last time we spoke about was the missing prescription for Hashimoto's, and we really dwelled into the strength training, which we can kind of go over and talk about today. But that episode was amazing. If anyone wants to go back to it, strength training and Hashimoto's 3 years ago, we smashed that episode.
Yeah, I forgot what we'd even talked about because I did like quite a few podcasts around that same time. So I'm like, who knows what I even said, but hopefully it was good.
What have you been up to? What's been happening in the world of Carolyn?
Oh man, yeah, just always just kind of grinding away and just trying to fine tune things, especially in my practice, just finding more ways to help more people because it's just, it's tough. There's lots of people who are in states that are not licensed for naturopathic doctors or countries where there aren't naturopathic doctors. And so my goal is always just to try and fill that gap, right? To give them information, to empower them so that they can get some benefits, even if they don't have direct access to a naturopathic doctor or like a functional medicine doctor. So I just continue to try and find ways to connect with more and more people and just learn more because there's always more to learn. It really never stops.
Yeah, I love that. I love the self-reflection of a practitioner. That just shows like growth, that just shows dedication, that shows passion for me. I love that you were able to self-reflect and go, I've recommended this for so many years, for so many patients. It's like, why do I do that again? What's the latest research that says it on there? It's like, am I telling them the right dosages? Am I telling them the right frequency, the right timing? Because maybe new research has come out and says, okay, maybe the timing is different now. Maybe the dosage is different now.
Yep.
And about peptides, we are going to talk about peptides. I want to drill into that. So keep that on there. If I forget to mention it, please mention it. We're going to talk about it. So
sure.
Yeah, so I love that you're, looking at the newest research, and that just shows what a good practitioner you are and how much you want your clients to succeed.
Yeah, and honestly, I have the most incredible patients, and they're all very good about like doing their own research, and they're always bringing new things to me. So it really helps to have patients who are involved in that process, which is something that like is practically a requirement at this point for my patients. Like I can't just tell you what to do and you do it. Like I need your feedback. I need you involved in this process. And so I'm really grateful that I have amazing patients who are always bringing me new things. So it kind of, it keeps me in that mindset of, what else is there out there? What can I be doing differently? Because, it's like with Hashimoto's, you see dozens of different presentations. And so what works for one person doesn't work for another. So it's nice to have lots of tools in your toolbox. So, like, okay, if this thing doesn't work, like we have alternatives. There's always a way. It's just figuring out what's going to work for that person.
Yeah. And I mean, let's take it back a little bit so the audience kind of understands why Hashimoto's, like, because you specialize in thyroid health. Why did you choose Hashimoto's?
Yeah, honestly, Hashimoto's kind of chose me in a couple of different ways. So when I was in med school, I actually thought like my focus was going to be with diabetes, type 1 and type 2 diabetes. I spent a lot of time learning about those. And of course you learn about thyroid, but it was kind of like, it's just over here. It wasn't a thing that I was as passionate about as I am today. And the interesting thing is when I got into practice, I kept getting thyroid patients, and I'm like, okay, so let me learn about this. And I was actually, I diagnosed myself with Hashimoto's years and years ago. So it's personal for me because I know what that journey looks like, and I know what a struggle it can be when you don't have the right help or you don't know what's going to work for you because like what somebody else needs to eat is not necessarily going to be what I need to eat. And so it's really through trying to heal myself and be my best self that I've, just developed this passion for women. And it's such in the conventional system here in the US, Hashimoto's gets missed all the time. Rarely is it actually tested for. And so I just felt like there was an incredible need for, there's other practitioners, got Isabella Lentz, all these other people doing it, but it's like, okay, on a local level, there's so much impact that I can have for women and men, right? There's men who get Hashimoto's too, but it's more women. But there's just such a big gap there that, for myself and for my community, it felt like the right move. And it's something that I could do it all day, every day. So that's when you're doing the right thing. It's like, this is all I think about. So it really helps to, benefit from that myself and for my patients.
Yeah, I mean, look, thanks for sharing with us your own story with Hashimoto's. I mean, it would have been, I guess, a struggle. What you said you self-diagnosed. What was happening when you were like, maybe I have thyroid issues? Like, what was coming up for you?
Yeah, so I had so kind of towards like the second half of med school, I knew I had adrenal fatigue. Like that's pretty much
We all
anybody
do when
who's
we're
in med
studying.
school. Yeah.
Oh my
So it's
gosh.
like, yeah. Like you can't escape it. You can't escape it. It's just kind of par for the course. If you're going into med school or doing any type of, training, like that's going to happen. And so I kept just chalking things up to, oh, this is just adrenal fatigue. This is adrenal fatigue. But then other symptoms kept coming up and things like, I was having trouble controlling my weight. So I used to be like 50, 60 pounds heavier than what I am now. So I was gaining weight and like nothing seemed to be helping. My joints hurt. I was in a lot of pain. The fatigue I had was incredible. It seemed above and beyond what I would have considered normal for adrenal issues. Like you can have some pretty severe fatigue with that, but it was a different level and my brain was just not working the way that I wanted it to. And my brain is everything to me. So it's like, okay, if my brain's not working, we've got a serious problem. And I had my thyroid tested in the past. And funny enough, I think if they had tested my antibodies back then, they probably would have been positive. But I was like, you know what? Let's just check and see. And sure enough, it was like over 1,300 antibody level. And it was like,
My
I was like,
gosh.
okay. I'm like, now I know what's going on. Now I need to dig in and figure it out. Because with the Hashimoto's, there's, typically adrenal issues and hormone issues. And I had all of the things. And I just felt so awful. But I was grateful to find that there was something wrong that I could at least work on.
Yeah, yeah. I love that you were able to reflect on that and be like, okay, this is what's happening. I'm gaining weight, I'm not losing it. I've got joint pain, I've got brain fog, fatigue to the max. It's like nothing's working. I can't shed this weight. What is the go? And usually, especially women, and I'm not putting them in a box, but we just go, I'm just exhausted. I'm just tired. I'm just putting on belly fat. Or I'm hit an age of 30 or 40 and I'm just can't lose it. My metabolism's going downhill. And like you said, even in the States, you said, and here in Australia too, it gets misdiagnosed or it doesn't even get any attention because by the time they get to test the antibodies, it's like months or years down the track because the first thing they usually test is TSH and it's like, oh, well, that's in line. And it's like, well, is it really?
Yep. And that's another piece, right? It's just, the standard reference ranges are not in alignment with what we see clinically. And even the research shows, TSH above 2 for most people, it tends to go up as we go older. So if you're in your 60s and 70s, we expect it to be, maybe up to 2.5 or something like that. But, even though we have really great research saying that TSH above 2 is very questionable for thyroid issues, still we don't get doctors testing for it. And you could have Hashimoto's for a decade before your TSH is ever even impacted. But if you can get it before you've actually developed hypothyroidism, it can make a world of difference in being able to reverse those things and heal the tissue. But if you're not screening for it, you're going to miss it, you know?
You just said some key things there. You said reverse. Interesting.
I would say, okay, maybe a better term would be to put into remission. I would say put into remission because the reality is, if you go back to living a lifestyle that is not in alignment with good health and what your thyroid needs, 100% it can come back. But you can also then again put it into remission. So yeah, reverse it is not the best term. It really should be putting it into remission. And that's true for, any autoimmune disorder. Like if you go back to eating, junk food, processed foods, you're not exercising, you're not dealing with your stress, it's going to come right back for sure.
Yeah, 100%. And reference ranges. That's really an interesting one. I think here in Australia, depending on the lab you're using, if your TSH is above 4 or 5, then it kind of brings attention to the doctors. I'm not too sure if the States is the same.
Yeah, so it'll vary a little bit by lab, but the typical reference range is about 0.45 to 4.5. So they don't even sometimes I've seen it where patients have come in and they're at a 4.7 and their doctor's like, oh, don't worry about it. We'll check in another year. And I'm like, are you kidding me? Why are we waiting to help this person? But it's a disease model, right? In the conventional system, they are treating disease. They are not preventatively driven. And so my whole goal is let's prevent you from developing hypothyroidism if we can, and prevent all the other things that come along with uncontrolled hypothyroidism. Like, get ahead of it. Why are we waiting until people are sick to do anything about it?
And I mean, you've got the individual sitting in front of you with these symptoms. Yes, the blood test is showing their TSH might be 3 or 4, but literally in front of you is a woman sitting there who has not lost weight for the last 5 years, is fatigued, is drained, has cold hands and feet, her hair's falling out, like skin is dry as, and it's like, well, we're not going to do anything about it until your TSH goes to 5. And it's like, what are we doing?
Oh, yeah. Yeah. And, it's very common here. It's like, oh, it's all in your head, or you just need to sleep more, or you just need to go on eat less, exercise more. Maybe you just need an antidepressant or some birth control. And it's like, look at the person in front of you. But it also makes sense when you understand their training, right? So, and how the system 100%. Works here. Yeah, because insurance dictates how much time they can spend with patients. This is why I don't deal with insurance, because I don't need somebody sitting behind a computer telling me how to do my job when I've trained for this, right? So it's different. If you only have 5 minutes with someone, I don't feel like you can make that connection where they're going to tell you maybe some of those deeper symptoms that they've been experiencing, because you don't even have the time to review that. So you're missing that bigger picture, right? And then, their training is all around meds. They don't get a lot of lifestyle training. That's starting to maybe change a little bit, but that's a slow process. And so they don't have anything to offer someone with Hashimoto's, because they're like, well, if your TSH is generally okay, I'm not going to prescribe a medication for you. Okay, well, what about what they're eating and how they're exercising and what is their sleep and what is their stress and are they getting sunlight and do they have deficiencies and all these other things? They're not trained in that, so they don't have a keen eye for those pieces. So it makes sense that they wouldn't test for it, because what are they going to do with it anyway? They don't know what to do.
Yeah, 100%. And just before you said uncontrolled hypothyroidism or Hashimoto's, that it causes things, can we go into okay, so let's say this individual, I don't know what we want to call her. Let's call her Emily, right? So Emily's gone to the doctors and she's got all these symptoms that we've spoken about. TSH is about 3.5, hasn't tested antibodies, hasn't tested T3, T4, reverse and so forth. And if she continues just going down, uncontrolling her hypothyroidism, Hashimoto, so-called, that she doesn't even know she has, what happens?
So many things. So, when we look at Hashimoto, so full name of it, right, is Hashimoto thyroiditis. And so anytime you've got itis on the end, that's indicating inflammation. And we know inflammation is the root of all disease. So, by increasing the overall inflammation in the body, that could be gut, that could be joints, that could be all sort of brain inflammation even, that Hashimoto is associated with brain inflammation. So all of these things are going to be impacted over time. And so it's putting you at risk for, a whole host of other diseases, cardiovascular disease, other autoimmune diseases. So it's increasing your risk across the board for various disorders and just the severity of symptoms. And so once you get those things under control, you get the inflammation down, it's night and day difference in terms of how people feel. So it's symptom, dealing with the symptoms and then dealing with the outcomes that'll happen if you don't start putting these things into control. And we're talking, I mean, bone health, all sorts of things are your thyroid controls, like so many different aspects, your skin, your hair, your cholesterol levels, your vision, I mean, you name it, right? And thyroid probably has a role in it. So if your thyroid is not functioning the way that it should be, if your things are not optimized, your levels are not optimized, it's going to have an impact across the board.
Yeah. So it's kind of like what we're trying to get at, or what you're trying to get at, Carolyn, is kind of like if you're having these symptoms or signs, investigate it, work with a healthcare professional. It's able to be like, okay, let's rule it out. Let's make sure it's not hypothyroidism. Let's rule it out, because essentially, if we leave it the way it is, it can cause so many more inflammation in the body. And then later on in the track, it's going to be so much harder. It can still work on it, it can still put in remission, and we're going to talk about how.
Yep.
But it's just going to be a lot more work. And these individuals, like this Emily lady, she's already drained. She already has no
Yep.
energy. And it's like, it's just it's gonna be a circle. And then most of them just go like, fuck it, I'm giving up. I can't deal with this anymore. I'll just take the medication. I'll just keep eating my junk food. I'll just keep living my life because nothing has helped.
Yep, yep. And then they end up on more medications because their symptoms aren't actually controlled. So then it tailspins from there. And the thing that I always think about, I'm like, man, these women have kids that they're trying to take care of, or maybe they're a caregiver for a parent or a family member. They're working jobs. They're like doing all these things. They have their own goals and aspirations, and everything gets put on hold when you don't feel well. And that's just such an unfortunate thing that it gets missed so much. And that's why I have such a big heart for these women, because they just, man, women are natural caregivers in a lot of different ways. And, I know that we can't say that across the board necessarily, but, they want to take care of their kids, they want to take care of their families, and they want to take care of their community and thrive as individuals. And you can't do that when you feel like crap.
Yeah, 100%, 100%. So essentially, one of the first things is like, go to your GP, your doctor, your practitioner that you're working with, get your thyroid tested. It's a blood test. Get your, correct me if I'm wrong, if I'm missing anything, TSH, get your T3, T4, reverse T3, your antibodies
Yep.
tested, kind of get the whole panel, and then get someone to interpret it who knows the reference ranges.
Yeah, yeah. Or at least, there's actually lots of good information online. I have in my on my page, I talk about optimal ranges. Isabella Wentz has a
Amazing.
ton of resources on hers. So even if you, again, like, because sometimes resources are limited, you may not have a practitioner in your area that has the right training. So it really, a lot of folks with Hashimoto's end up having to advocate for themselves and educate themselves, which is kind of
Yes.
another layer of things, right? It's like, okay, you're kind of like mini doctors running around trying to figure out how to do this thing. But luckily there's lots of resources. But yeah, getting the proper tests done and then figuring out if they're actually in the optimal ranges versus just in the reference range, and knowing how to interpret those. Like, you could have a normal T4 and a normal T3, but maybe your conversion is not great, right? And that could be shown by
Yes.
those levels. That your reverse T3 will indicate some of that. And sometimes too, you have things like where you're seeing early signs of Hashimoto. So maybe their antibodies aren't quite positive yet, but they're a little bit suspicious and they need to be watched. Or you have like seronegative Hashimoto's where they don't actually have positive antibodies, but you do an ultrasound and then you see evidence of Hashimoto's there. So there's a lot of different considerations, symptoms,
Yeah.
blood tests, ultrasound, lots of pieces you got to look at to really make sure that you're doing your due diligence.
Yeah. And so if someone like Emily now comes to you and has been diagnosed with Hashimoto's, what happens then? Like what do you run through? What do you do? What is some information that can be given to her? I know this is not medical advice that we're giving here on the
Yeah.
podcast. This is all individual based, but just kind of like roughly information that you can share with us.
Yeah, so I always start with making sure that the lifestyle pieces are in place because your lifestyle is really your foundation. I can give you all the medications and supplements and, treatments and things in the world. But if that lifestyle piece is not in place, it's like filling a bucket with holes in it, right? It's like, okay, like you can
Yeah.
keep filling it, but once you stop, right, everything's just leaking out. So building a good foundation, so making sure that they're eating the right foods. And sometimes that requires, let's say, doing an elimination diet, looking at their gut health, see if there's underlying gut infections like H. pylori and SIBO and Candida and all
Do
sorts
you
of things
see
that
that
are
often?
incredibly. I do. SIBO I
Yeah.
see a lot. H. pylori, I don't see quite as much, but it definitely happens. So making sure that their gut is functioning, because if your gut's not functioning, you're not absorbing your nutrients, right? And then we know a good portion of your immune system lives in your gut. So if your gut's not healthy, that translates to not as healthy of an immune system either, which is obviously important for Hashimoto's. So, getting their gut in order, getting their nutrition in order, making sure that they're exercising. What exercise looks like for people might be different depending on where they're at in their journey. So sometimes I'm like, hey,
Yeah.
I just need you walking every day. Or if they're a little bit more advanced, I'm like, okay, I want you strength training 3 times a week, doing some stretching, those types of things. Making sure their circadian rhythms are in check, like making sure that they're getting sunlight in the morning, that they're getting afternoon sunlight. Make sure they're not staring at their screen right before bed. So throw those blue light blockers on, or just don't do screens. So circadian health is incredibly important, because that will
Yes.
also translate into adrenal health, which, like I mentioned earlier, adrenals and thyroid, I mean, those go hand in hand. I would say, like, probably 8 times out of 10, right? If they have a thyroid issue, they have an adrenal issue. And the adrenal issue may have led to that. And then you kind of get in this vicious cycle. So getting all those foundational things in place, addressing their stress, that's another big one. Sometimes easier said than done, but it's also about like building their resilience, right? It's like, well, sometimes you can't quit your
Stress
job,
less.
you
What is
know?
that? Go on
Yeah.
an
And I always
island
tell,
and your Hashimoto's will be fixed.
right, it probably would be, but that's not life. So, teaching people ways to be more resilient to their stress, right? Because stress is a part of life, and we actually need healthy stress. But when you're in adrenal fatigue, when your nervous system is dysregulated, it makes it so much more difficult to deal with those things. Like at the height of when my adrenal fatigue was at its worst, when my Hashimoto's was uncontrolled, I mean, even just having lights on was irritating to me. I would, these are the
Wow.
people that drive around in their car without any music on, because like they just cannot stand any external stimulation. It's too much. So always starting with those foundational pieces, and then assessing gut health and hormone health and adrenal health. Like those are kind of like the big pieces that I always got to make sure that those are in alignment. So foundations, and then kind of those 3 areas, seeing if there's any issues there that need to be addressed. And then we just kind of build from there depending on what the individual needs.
Yeah. Hormone health. Do you see a lot of women have estrogen issues that have
Oh yeah.
Hashimoto's or like, yeah.
Yeah. So what a really common pattern that I see is that, so you have to remember that cortisol, which is our stress hormone, right, produced by the adrenals. So oftentimes, if you have adrenal dysfunction, cortisol can be high or low depending on where you're at in that disease process. But cortisol is in the same pathway. It's called the steroid hormone pathway as progesterone and estrogen and testosterone and pregnenolone. So if you have a cortisol issue, you're likely going to see some issues down the line. One of the main things that I see is that their progesterone drops. The way I think of it is this, is like, if your body is under stress, the last thing it wants to do is make a baby. Right. So it's like, nope, we're going
100%.
to drop your progesterone. Right. And we're going to like shut that off because we need you to heal. We need you to kind of hibernate and get better before you're ready for that. Not
Yeah.
to say that you can't get pregnant in those circumstances. Lots of people get pregnant under stressful circumstances, but in general, that's kind of the body's protective mechanism. And so when your progesterone drops, even if estrogen is normal, you have this relative imbalance between the two that most people refer to as estrogen dominance. So it's very common for women who are cycling regularly to have heavy periods, painful periods, sometimes irregular periods, because we have polycystic ovarian syndrome that's actually connected to Hashimoto's as well. So sometimes they're skipping periods and having like androgen type symptoms, growing hair on the chin, all sorts of things. So hormone health is incredibly important to thyroid health. And even from the realm of, birth control has a huge impact on, how well you can control Hashimoto. So across the board, hormones are important.
Yeah, 100%. I love your knowledge. I love how you explain the link between cortisol and estrogen and progesterone. Absolutely love that. And hopefully the audience can make a link and be like, okay, that makes sense, because I've seen a lot of individuals who do have Hashimoto's have a lot of hormone issues, but also a lot of gut issues. So those
Yep.
two 100% stand out, and you've touched upon them, which is amazing, for them to get a bit of a clearer picture. And it's like, it's easy. We'll go back to what you said, how people say it's all in your head. It can be easily said it's all in your head, because it's like, well, how does the gut connect to the thyroid and this and that? And I'm getting this, and it's like, it's a mystery. Well, it's not really a mystery if you know how the body works, how the biochemistry of the body works. It's not a mystery at all. You just got to put the missing pieces together.
Yeah, things don't work in a vacuum. That's why it's always kind of funny to me to think about like specialists, like all they do is gut or all they do is, cardiovascular health. And I'm like, yeah, but you have to see the whole picture, because it's not like your heart is just operating separately over here, or your gut's kind of over here. What's happening in one, yeah, right? What's happening in one
Yeah.
place is happening, is affecting the entire being. And that's why I love not contracting with insurance. I love being able to spend time with my patients. I spend like 90 minutes on that first visit, because I want to know head to toe what's going on, because then I can see that bigger picture and be like, okay, where do we need to start? Because sometimes that's the hardest part, is like, well, you have a
I
million things
know.
going on. Like, I need to figure out where's my end?
Literally.
Like, where do we get things rolling? Yeah.
And then they walk out, and all you said, go look at the sun, and they're like, how does that going to help?
Yeah. It's always so funny. I'm like, just trust me, get outside, be in the sun 10 minutes before 10 a.m. We're going to be good, right? And
Literally, it's
they're
like we have so
oftentimes
much
surprised.
research. There's like so much research backing this. I've done so much research on this, but it's as simple as go outside and look at the sun.
Yes, get some electrolytes, like the basic things. But, it's hard because at least here, it's prescription. Everything is so prescription driven. And even from like what I call green allopathy, which is like, okay, well, instead of giving you a medication for your supplement, we're giving you, or for your symptom, we're giving you a supplement for your symptom.
Yeah.
And there's nothing wrong with, managing symptoms. I'm not against that at all. Symptom management can be incredible while you figure out what the underlying issues are, just to get someone comfortable. But if you're literally just giving someone something to get rid of a symptom, you're not dealing with what the underlying cause is. So medications are great, supplements are great, but you can't negate like what's the underlying work that needs to be done? What's the groundwork? What's the foundation that needs to be built in order for that person to thrive?
Yeah, I always say we can put the symptom aside with this supplement or this herb whilst we work on this, because your lifestyle, your life is going to get better, your quality of life will get better, but we're not going to depend on this, because we're going to be working on the underlying stuff. And so I love that. I love the philosophy.
Yeah, exactly. It's like, because it's hard to exercise if your energy's low. Okay, well, let's get your energy up, get you exercising, right? And then we can get you off that supplement later.
Literally. Tell us, like, a lot of people come to me and they ask questions about thyroid health, and they always say food, right? Like, what food should I avoid? What food do I need to eat? There's a lot of stuff about like goitiers, like kale and broccoli and all of these foods, about meat, about tofu, about soy. There's like so many things. I bet you I'm hitting those trigger points, aren't I? All the questions that you get.
Yep.
Well, we're gonna dig
Yep.
into them. We're gonna dig into them. All right. Well, Carolyn, enlighten us. Like, what is the GO with the food?
Yes. This is the most common question I get, because there's so much varying information out there. So much varying information. What I always tell folks is, think of yourself as the tester, as the experiment, right? Like, you have to be willing to try things out for yourself and see how they're going to work for you. But I will say, when I'm first starting with a patient, usually what I'm going to do is I'm going to walk them through an elimination diet, right? So we're cutting out the things that are most likely to be problematic. And I do a pretty strict elimination. There's different types of elimination diets too, right? So you can't just say, oh, elimination diet. Well, what does that look like? What are you taking out? So what I have found over the years that actually works the best for my patients is a carnivore elimination diet. So we're taking out vegetables, we're taking out grains, we're taking out dairy, we are taking out soy, right? It's really like meat, salt, water,
Yeah,
and maybe
wow.
some fruit. Yeah, so it's very strict. Now, I always tell folks, this is not meant to be long term, right? We're doing this for a
Yes.
period of time. Get your inflammation down, give that gut lining time to replenish those cells. Let's get some fresh cells in there. And then after a period of time, which I always start with 4 weeks, that's good for
What do
most
they eat
people.
in those 4 weeks?
Yeah. Meat,
So what's the...
they can have salt. Yeah, so any
Yep.
type of animal protein.
Wow.
So
Okay.
yeah, red meat, fish, chicken, turkey, really just any animal protein is fair game. Eggs, most of the time we're taking those out because those can be a big sensitivity. So it's very strict. So I always tell them, like, listen, I need you to commit 100%. So if you've got a vacation in a week, this is not the time to do it, right? We can start at another time. I need you for 4 weeks, 100% committed. And usually after 4 weeks, like, we've got most of that stuff cleared up, their gut's feeling better, maybe skin's starting to clear up, energy's better, and then we can start that reintroduction phase. In some really severe cases, they might have to go 60 or even 90 days, but rarely do I actually have to do that. That's really just in severe cases where sometimes there's multiple autoimmune disorders and things are really dysregulated, but usually 4 weeks. And then very methodically, we start reintroducing foods to see what they react to. And you got to make sure that you do that the right way because there can then be overlap in symptoms. So I always start
Yeah.
with, almost always start with elimination and then build their diet up from there to see what's going to work for them. But even that can be
Yeah.
kind of tricky. Like sometimes you reintroduce and you find they're still reactive to a bunch of different things, and then that's my cue, like, okay, there's something else going on here. Maybe there's an infection, maybe there's some dysbiosis that still hasn't been cleared up. And so that's when we might do a more comprehensive gut test, like I like the gut zoomer is a really good one
Yeah.
from Vibrant. There's some good comprehensive stool analysis out there. So sometimes it gets us where we need to be as far as figuring out food, and other times it's like, nope, we need to dig deeper. There's something else going on.
Yeah. So what is the reasoning behind doing the carnivore and the meats only? What is there a reason why we're doing that for 4 to 6 weeks? What is the underlying
100%,
factor?
100%. Yeah, so it's the most basic foods, right? Very rarely are you going to see, unless someone has like alpha gal syndrome, right? Rarely are you going to see someone who is going to react negatively to meat. The only issue that can come up, which I preface, talk to all my patients about this, is that it's very common for people with Hashimoto's to have low stomach acid. So sometimes they have a hard time digesting their meat, or they might not have good enzymes, and so there's sometimes some supplementation that happens to make sure that they can get through this. And there's some patients who don't do well with the elimination, then I have to find another route for them. But the idea is that we're taking out anything that can be creating inflammation and creating some type of an immune response. And it doesn't mean that the other foods are unhealthy, right? It doesn't mean, and a lot of times, like with the carnivore, like I'll let them have some fruits too, like good quality fruits. Most people are not reactive to fruits,
You're
especially
allowed to have
berries.
some blueberries?
Yeah. Throw some berries in there for sure. Like very rarely is anyone going to have a
Have
reaction
some
to
berries
those. So I'm
with your
like,
steak.
yes. And you really like learn to love those berries during the elimination because it's like,
Yeah.
that's your sweet treat. But like even things like veggies, right? We generally consider veggies to be very healthy, but some of them are high in oxalates and can be problematic for certain people and might create, things like pepper, some of the nightshades, peppers and potatoes and those things have also been shown to sometimes be problematic for people with Hashimoto. So we want to eliminate any opportunity for there to be inflammation, to be immune system, for there to be immune system stimulation. Like we are trying to take it back to the very, very, very basics and then build from there. So it's not a long-term thing. I don't think, I know there's some people who do carnivore long-term. My personal belief is that it's not meant to be a long-term diet. It's really meant to kind of give you more information so that you can build a diet that's right for you. But it's a lot of just self-testing and figuring out what's going to work for you. And there's certain things like dairy can be very interesting. Like, some patients can do hard cheeses, but not soft cheeses, or they can do raw milk, but not pasteurized milk. So there can be a lot of nuance within that too. So it can take a while sometimes to really hone in on what works for somebody. But I think the carnivore elimination is a great place because it just eliminates all the potentials for reactions to happen.
Yeah, amazing. Thanks for sharing that. It's interesting
Yeah.
that you said doesn't mean that vegetables and those other foods aren't healthy. I love that you mentioned that, and I love that you said that this isn't a long-term thing. This is just for us to figure out what's happening, give the body a bit of a break. But then also, some people aren't able to digest that much meat, so we're going to give them some support via herbs or supplements to help with that with those juices, with those digestive juices. So that's really interesting. A lot of people wouldn't have thought that that's what would be the go to do. It's kind of like, oh, interesting. I thought you were going to be like, let's go juice fasting or things like that. That's what most people think about when they say that. But it makes sense when you're thinking about eliminating things that may cause inflammation, because we know sometimes, like you said, some grains, some vegetables, some eggs, and some other certain foods can cause an immune response in our body, and therefore affecting our thyroid in a negative way.
Yeah. So to me, it's like the quickest way to get someone back to baseline. Usually within a couple weeks, the majority of the symptoms are cleared up. And then, the next 2 weeks is kind of like just giving the gut lining time to heal up. So it's actually pretty incredible how quick it can happen. But sometimes people need to move a little bit slower. If you're coming from like a standard American diet, if you've been eating, burgers and fries and like frozen foods and processed foods, sometimes we just have to start simple and like, okay, let's just eat real food first, right? Let's get you doing that. And that might clear, most of their stuff up. So it kind of depends on what their background is, where they're coming from. And then we find a starting point that really makes sense for them and is doable for them. Because sometimes doing that 180 is not the best choice for the patient. So yeah.
It depends where they are in their journey. Like you said, it's kind of like, well, if you're eating fast food every single day, we can't get you to up here or to this level that quick. Let's go slowly with the journey and see where it takes us. And I love that individualized, personalized medicine approach. And that's what happens when you work with a practitioner like yourself or other individuals, is you get that personalized. And it's like, okay, this is what I usually eat. How can we do this with my energy? Because Emily might not have enough energy to push through and go to the butcher's every day, or go to the butcher's and get fresh meat. It's like, okay, cool, we can do that these days. These other days we can do this. And that's where the accountability is there, the support is there, and the individualized approach.
Yeah, exactly. It's all about figuring out what's going to work for that person, because there's always so much nuance, and what does their life look like? Did they just have a baby 6 months ago? Okay, elimination diet may not be appropriate for you. You're breastfeeding, you're trying to recover, like we just need nutrients on board. So time and place. And so sometimes the journey takes longer than what you want, right? It'd be great if everyone could just do a strict elimination 4 weeks, but like that is not going to be appropriate for every person. And so we just find what works for them.
I can hear those A-type personalities being like, yep, let's go 4 weeks, done.
Yeah, those are my people. I'm like, awesome, let's see it. But yeah, I would say that's like few and far between. Straight up, they will, or they'll go in on a bunch of salmon or something and have like, 20 pounds of salmon now.
Yeah, I will go fishing. I will buy a boat, go fishing, and eat that food.
Those are my people. God bless them,
Yeah, love them. But, you also got to calm and take a deep breath, because that adrenal with that A-type personalities, don't wear that out.
Yes. Yeah, those are the people I'm like trying to get them to slow down. Like, it's going to be okay if you're not in the gym 7 days a week. I promise you, like, just slow it down. But, I get it. There's different personalities too. So it's like, all right, what type of lifestyle are they trying to live? And what are they willing to give up or not willing to give up to reach those goals? Some people, they're like, I'm cool if I'm 75% better. Cool, that's your goal. We'll get you there, right?
Yes,
and if you decide you want that other 15%, we'll go for it. But,
and
they decide what's right for them. Yep.
Yeah, you're so right. Not everyone has the same goal. Like you said, in our heads as practitioners, we're like, you want optimal health. You want 100%. But then we might project that on them and be like, well, actually, you don't. Like you said, you had a baby 6 months ago. You kind of just want to get 20% better. You just want to be able to get through this stage and just be okay. And it's like, okay, cool. We can work with that. We can make this happen.
Yeah, and then, once they reach that goal, they might say, okay, well, now I want to work on my libido. I want to work on these other pieces. So it's like, I always check with them, what's your goal with working with me? What do you want to see happen in the next 90, 3 to 6 months? What do you want life to look like? Let's work on that. And then we can always adjust.
I love that. I love the personalized. Is it time to talk about peptides? Can we talk about peptides? Can we go into it?
Yeah, let's do it. Let's do it.
Tell me everything. I want to know the research. I want to know what you've done. I want to know the experience. I want to know what you figured out. Give us the down low on that.
Yeah. When there's so many different peptides, but I think probably the ones that make the most sense to touch on in this instance would be the, some of those GLP-1 receptor agonists, because I know,
Should we
right,
tell people what peptides are first before we go into it?
Oh, yeah, yeah. Okay, so peptides in their simplest form. A peptide is what makes up, these are, what make up amino acids, make up proteins, right? And so there's lots of different peptides available. And despite them having a lot of press recently, they've actually been around for a really long time, and can be really incredible in a lot of different ways. So yeah, these are just building blocks, right? And there's different ones that hone in on different areas of the body. Some are going to be better for your gut, some are going to be better for your brain, some are going to be better for your, pancreas and all of those things. So and there's a lot of overlap too. And I would say, the one of, kind of the class that's been most popular lately has been those GLP-1 receptor agonists like Ozempic, which is known as semaglutide as well, or tirzepatide, which is Mounjaro, and Zepbound, I think is another name for it. But these, a lot of people are using them for weight loss. And so they're getting a lot of press lately. And it's really actually kind of interesting. So when they started to get a lot of press initially, I was like, I don't know how I feel about these. Like, I'm going to kind of sit back. I'm going to do some research. Like, let's see what's happening. And one of the things I saw, because I get it, right? A lot of women who have Hashimoto's, have hypothyroidism, struggle with their weight. And they feel like they're doing all the right things and things are just not budging. And so, like, when I go through, their history, a lot of them really are doing all the right things, but there's still this inflammatory process that we've cut all the things out. We're taking the supplements, we're taking the medications, and we're still just not getting there. And so it's like, all right, what else do we need to do? So what I noticed initially was like, okay, a lot of people are having GI symptoms as a result of taking these peptides, these GLP-1 receptor agonists. And obviously that's going to be problematic, especially constipation. Like, we already deal with constipation and Hashimoto's and hypothyroidism. We already deal with slow motility in the gut. We don't need to slow this down anymore. So I was like, all right, don't love that, right? That's a little bit problematic. The other thing that I saw is that the way they do it is you get one dose, you do that for 4 weeks, right? Then you bump up, you do that for another 4 weeks, right? And you do that basically until you reach the max dose. I'm like, well, that doesn't make a whole lot of sense to me either. What if somebody's getting really good results on the low dose? Why do we have to bump it up? Like, that's just logically, that doesn't make sense to me. Why are we maxing it out? What's the point of that? And if you're using it for blood sugar control, like that's kind of a different aspect. But even then, I'm like, why the jump? And then, of course, there was some of the negative things that came out, like, oh, can this cause thyroid cancer? Obviously, that's a big deal for people who have thyroid issues. Hashimoto's in and of itself can, potentially slightly increase your risk for thyroid cancer. So it's like, okay, well, we don't want to add to that. Reality is that was only rat studies. We have not seen that in any human studies. And we know we are different from rats, right? But they put it on there because it's always out of an abundance of caution. But we haven't seen any human cases of that. So I don't have any concerns about that piece. So as it stood, the way that they were conventionally available, I was not a fan of that. But then our compounding pharmacies started offering them, right? And so then you have full control over the dose. You can draw up as much or as little as you need. So I thought, well, this is interesting. And when you dig into the research, there is some incredible research behind how these can have a positive impact on the immune system, how they can have a positive impact on inflammatory levels. And I don't know if you've ever talked about this on your podcast, but a lot of people with Hashimoto's deal with various mental emotional things, anxiety, depression, obsessive compulsive disorder, ADD, ADHD. So there's all this like mental chatter things that can happen too. And so really, really good research around those, and even around addiction. Right? We see like people who have alcohol addiction or nicotine addiction or cannabis, whatever it might be, right? And that chatter seems to go down. So I thought, okay, I'm always a fan of like experimenting on myself or my willing family members to see what happens. I'm like, well,
I always experiment on myself, always.
Yeah, right? Because I'm like, well, I don't want my patients really to be the guinea pig, so let me be the guinea pig. When it makes sense,
We are your guinea pigs. We are your guinea pigs.
100%. 100%.
We do it for you. We do it for the audience, for our clients.
100%. I'm like, I'm willing to try most things, right? So, I had a couple of family members who also have thyroid disorders. We're looking to lose weight. And I was like, all right, are you down to like experiment with me? Let's see how this goes. And I started them on, my little micro doses. So less than half of what a typical starting dose is, conventionally. So we're starting with little tiny doses. And, some of them needed to titrate up to get the results that they wanted, but a lot of them just stay super, super low dose. And I don't have anyone that I've maxed out on, like not even close, right? Unless they actually have diabetes too. So keeping it super low dose. And just to give you an example, I had one patient, her TPO antibodies were over 1300, right? And that's the upper end of what the lab can test, right? So it could have been 1800, it could have been 1301. We just know it was over 1300. And in the course of 3 months of doing a microdose, and it's a once weekly injection, super simple, right? It's subcutaneous, so it doesn't hurt. It's like a little baby injection. But over 3 months of doing that, her antibodies dropped from over 1300 down to 300. 300, right? I don't remember how much weight she lost.
That is
awesome. It was incredible.
And it could have even been higher, like you said.
Yeah,
it's like,
yeah.
You don't even know what the drop was, but it dropped to 300. That's insane. And you said 3 months, and it was microdose.
3 months. 3 months of a microdose. Wow. And I was like, okay. Wow. But then, like, symptomatically, what did we see? She had peripheral edema, so swelling in the legs. That was completely eliminated. Her energy was better. She felt like she had better mental clarity. She was performing better at work. She wasn't having to write sticky notes for every little thing. Like, she just felt like her brain was actually functioning the way that it was supposed to. She struggled a lot with what I called food chatter, which is, you're not like really hungry, but you're like, let me go check the pantry. Let me go check the fridge. Like, let me just see if there's anything going on in there, right? And that food chatter really came down. And we know, right? It's used as an appetite suppressant. So that didn't really surprise me. But she did struggle with, a little bit of alcohol use, and like easily eliminated that. She's like, I don't even think about it anymore. It's not even a consideration for me. Her joint pain went away. She had some asthma.
Huge.
She's no longer using she's no longer using an inhaler. She was on a daily inhaler. So it's just incredible, the things that I saw. And I'm like, okay, I see that these things are getting demonized, and everyone's saying, everyone's just using that. They're not changing their lifestyle. They're not doing this, not doing that. Like, the Ozempic face and all these things. And I'm like, you guys, if they are used appropriately, can be a game changer, and you don't have to stay on them forever. Like, I get my patients to their goal, and then I titrate them off of it, and all of them so far have been able to maintain their results without going back on it. Wow. And I think it's one of those things that you could cycle. Yeah. And I think it's one of those things that you could cycle. Like, let's say life happens, right? And maybe they just get a little bit off track. Maybe they're in a Hashimoto's flare. So maybe we microdose for a month or two, get you back on track. Cool, get back off of it. So that's the other piece that I get a lot of questions about. Does this have to be a forever thing? Nope, absolutely not. Like, we just kind of roll with how your body's utilizing it. And it's just, it's sad because a lot of people are just misinformed about how these medications work, how these peptides work, just because of what the press is showing. And I feel like there's a lot of room for them to be utilized in a really healthy way, and as part of a comprehensive program. 100%, if you just do that and you don't change your lifestyle and you don't do any of those other things, you're not gonna get the results that you want. But my patients know, right? They know what they need to do. They're doing it anyway. They just need a little bit of help to get over that hump.
Yeah, wow, that was amazing, and I love that you went into the detail of how it works and how it's going to help. But I think the key is the personalization. You said you've never topped anyone, as in like to a top max of the dosage. You started with slow microdosing. You saw results within 3 months. You took them off it, and they were able to maintain. And that's the key. That's what we want for our patients, is to maintain what they have. And like you said, you can always cycle, like if things happen. And I think it's with individuals with Hashimoto's hypothyroidism, is like you said, it's the mental chatter, it's the anxiety, it's the OCD, it's the depression, it's all the mental things. And it's like, if they know that they have this one thing that they can potentially cycle, that drops that chatter, that drops that anxiety, that drops that depression. So even just by having that in the back of their mind, you've assisted their hypothyroidism.
Yep. Yeah. And it's just been such a light for my folks, like where they felt like there was nothing, right? Nothing that was going to help them. They were at their wits' end. And it's been such a beautiful thing to be able to offer to people without judgment. Because that's the other thing. People come in and they're like, okay, I kind of want to talk about this, but I'm afraid of what you think. And I'm like, first of all, never be afraid of what I'm going to think. I don't judge anybody. Like, you come here as is, like, I'm going to love you regardless. And I'm going to work with you, like, no matter what. Like, just come as you are. No conversations are off table, right? But it's just hard because they're getting that message that it's not a good thing, that, you're going to get sick and all these other things. And it's like, nope, there's a way to do it that can actually work for a good chunk of people. Does it work for everyone? No.
Yeah.
Right. And I've had some people who didn't do well on semaglutide, but did well on tirzepatide. So there, again, the individualization piece of it really matters. And even sometimes just DOP1 receptor agonists are not a good fit for them at all. And we look at other peptides that are available that might be helpful for them, or, low dose naltrexone, or, one of the many other things, other tools that we have in our box.
I love that. And there's so many tools, like you mentioned so many things. You mentioned lifestyle.
Sorry.
Even like looking through your Instagram, because I follow you and all your information is absolutely amazing. You talk about things like saying no. You talk about the mindset. You talk about, the carnivore stuff. You talk about peptides. There's like circadian rhythm. There's like so much information there. I mean, individuals like, if they ask me what to do, is like go and visit your Instagram page. I know it sounds crazy, but it's like you have so much information there. It's crazy. And even through this podcast, you've mentioned like so much valuable information that can help people to have a starting point. And I can see and I can feel, and I'm pretty sure the audience listening can also feel your passion for it. And it's like, if I have hypothyroidism or Hashimoto's, it's like you are the person that I would want to talk to, because there's so much drive, there's so much passion. You will research the latest research on it. You will find those peptides. You will look at the research of like, okay, maybe it's not good for my thyroid. I'm not bummed down. It's a mouse study. It's a rat study. It's not, I'm not going to focus on that. I'm going to change the dosages. You do the research, but then you also like trial on yourself, trial on other people. And that's what makes a great practitioner. And I love that you were able to share all of that with us. Like, I absolutely love that, Carolyn.
Oh, thank you. Yeah, like I said, when you love what you do, it just makes everything easier. Like, it doesn't feel like work to me. What feels like work is like doing all the accounting stuff, all the back office stuff. But like, when it comes to this stuff, it's like I could do this all day, every day. That's why I like doing my master classes. I just get to sit and teach, and that's really, I just love teaching people. I'm a teacher at heart. I used to teach, anatomy and physiology, and it's just, I just love to teach people, because there's so much to be gained from that. Now, of course, right, you can gather all the information, but you then also have to put it into action. So I always remind folks, like, you can get all, have all the resources, you can read all the books, but what did you actually do? What did you take action on? That's really where, it turns it into something different.
100%. So you said you do masterclasses. Is that for the public? Is that for patients to look at, or is that for practitioners?
Yep. So nope, I've done it for, I have done one class that was for practitioners, but that was like through somebody else's program. But I just recently it was a 2-parter master class, and it's just kind of like how to be your own thyroid doctor, right? So I walk them through like, here's the labs you need to run. What are the reference ranges? Where do you start with treatment? What does diet look like? So I really break down, a lot of those things that we've talked about. I just go into a little bit more nuance. So I did 2 different sessions, and they're an hour each. And so I didn't this time. Sometimes I'll charge a little bit for them, but this last one, I'm like, you know what? I just need to get information out there. So I just did it for free, and it's fun for me to do. So.
Wow. So I'm going to have to get that information off you and put it in the podcast notes so individuals are able to jump on that. That's a huge bonus. Wow. That's amazing.
Yeah. Yep. We get on a live call, and then, I usually try to leave a little time at the end for people to ask questions, because, man, people have such great questions, and I know, like, it's hard to navigate on your own. So, I always try to leave room for people to ask.
I love that. Before we let you go, as this is a natural podcast, I want to know, what are your natural health hacks or hack that you're like, I do all the time. This is what keeps me healthy. This is what keeps me going. And this is what's going to make me live over 100.
Oh, man. It's really, a lot of people want to think about like, what's the, I need the red light therapy, or I need the sun, I need this thing. Really hone in on what are the things you do every day. Like, I have, some of my family members will make fun of me, but it's like, I go to bed at the same time pretty much every single day, right? I start my bedtime routine at the same time every day. I, start my morning the same way. So it's really about those consistent things that you're going to do. So when I really start working with patients, I try to get them because it's very overwhelming sometimes, right? There's a million things that you could do, right? But let's start, I'll give them like 1 to 3 things, and let's just build that habit. And once you've got that habit, go to the next thing. So I would say consistency in those basic lifestyle things. Get your electrolytes in the morning. having 3 meals a day, if that's what's right for you, getting enough protein, like whatever you're going to do, be consistent with it and then build and build and build. And just know that it's going to take time, right? It's taken me years and years and years to get where I'm at. And I still feel like I'm constantly fine tuning, right? Because then, you get into perimenopause and things change, or you get into menopause and things change, right? So it's for us women, especially with the hormone shifts that we go through, it's always kind of fine tuning. But whatever you're going to do, try and really be consistent with those daily habits, because those will stack up and they will make a difference in the long run.
100%. Like you said, they'll stack up to build the foundations, and you can build, and it becomes a habit, and then it becomes a routine, and then you build something else on top of it, and it's just a stack on effect that leads you to optimal health.
Yep,
I love
absolutely.
that. Absolutely amazing. Well, thank you so, so much for joining us on Natural Podcast. Really appreciated you taking your time out, your valuable time out, to share your experience with Hashimoto's, your knowledge on it, and your passion for it.
Thanks for having me. Any opportunity to educate more people and get them thinking about what they can do for their health. Huge fan, and I'm so glad to be back here.
Thank you for joining us at Natural Podcast. And remember, you're pure love, capable of living life to its fullest expression.
Content and information provided here is opinion of Mahela Raguse and is for information purposes only. It does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. And in the circumstances shall the Natural Podcast, Mahela Raguse, any guests or contributors to the Natural Podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting a doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.